welcome to the HCEG Annual Summit happening here in Boston, Massachusetts. I'm Mabel Jong, and I'm here now with Ricardo Johnson, who is Senior Director, HealthWorks at CareFirst Blue Cross. Good morning to you, Ricardo.
Good morning. Good morning.
Well, you're going to be making a presentation a little bit later today. Follow the Money is the title of the presentation. Follow the Money to identify technologies defining the future of healthcare. Can you give me a sneak peek on what that all means?
So I think what we're talking about on the panel is a number of things. And so one is following the money from a health insurer perspective and sort of what we decide to invest in and how we engage, and looking at what are the things that we spend the most money on. But also from a, what HealthWorks is for CareFirst, is its corporate venture capital, corporate development arm, looking to help drive innovation in the company through making investments in startup companies and strategic partners. And so we're looking at areas where we've seen investment activity, as well as the areas that we're generally interested in and that we've seen payers interested in, funding to drive the innovation in the industry.
Can you share with me some of the focuses that you're going to be really concentrating your interest in this year?
Yeah, so for us, we're focused on a number of things that continue to improve quality, drive down cost, but also taking a look more at how do we engage as payers with our members as consumers, more than we have in the past, as we look to influence provider behavior and what employer accounts perspectives are. And we're still doing those things, but really seeing consumerism in healthcare play a large role. So how do we engage with our members more proactively? How do we offer them experiences that are more meaningful experience than what the healthcare industry has traditionally given them? And then how do we, as we say at CareFirst, focus on the whole person? And so there's a big drive that I've seen recently around social determinants of health, both as much of the growth in healthcare is in the government program space, but also in the commercial space. Both, so thinking about transportation, food insecurity, how do we help members actually be prepared to engage with the healthcare system and to heal and potentially prevent illness because of their environment and surroundings outside of what doctors can do for them.
Yes,
I'll tell you a little bit about sort of around where we think there should be more investment around social determinants of health. So there are, in the social determinants of health space, you have a lot of investment now in aggregating community organizations and being able to send referrals to community organizations to get members connected to organizations that provide food or provide transportation. We think that there's a broader way to view social determinants of health and where we should be putting our investment and our focus. And first is identifying the members and knowing their needs. So if you think about the continuum of social determinants of health, of identification, prediction, and intervention, there's been a lot of money focused on the intervention side. There's been some money focused on the identification side. We think more should be focused there. So before we put in tons of money into transportation and food insecurity, let's actually identify that that's the need people have and what that impact may have, what that impact may be on a particular community. And then let's put some money into these community-based organizations who right now are getting a lot of referrals, but they're all nonprofits. And at some point, we'll not be able to sustain the volume that payers and providers want to send to them to essentially provide free services. And so how do we buttress that ecosystem while also making sure that we're directing the right members there? And so we have been looking at investing in companies that are around analyzing social determinants of health data, combining it with claims data and medical record data to actually target communities down to blocks of zip codes of there's a food desert here. Let's figure out what resources we need to provide.
Is it something you're going to be partnering with other companies with, or is it an investment that you're going to be making within
So both, but I think that there's in this context, it's something that we have to partner with other companies to do. There are companies that are building these models, are doing it better, and have access, once you have an outside third party that can do it, that's doing it, to multiple levels of data, not just any one payer or any one provider system, that helps build better models and make the identification and the prediction piece of this better.
Okay.
And so that's one area that we're putting money into, and that we're seeing others put money into as well.
Right. Okay, Ricardo, and what are your impressions of the summit so far? I know we're just getting into the. You had a lot of fun at the game yesterday.
It was a lot of fun at the game.
Yeah.
Although the Red Sox lost, I'm an Orioles fan.
Oh, okay.
So the Red Sox losing wasn't really an issue. The Yankees winning is a bigger issue. So far, I mean, the conference is a great conference for the level of executives and people that you have in the room talking about issues. There's not a lot of primers at this conference, which is nice. You've got people who are ready to dig deep on issues and can have executive level conversations pretty quickly, and identifying, I think 3 or 4 yesterday, potential partnerships between our organizations and how we can work to solve some of these issues together. So first time, but won't be the last.
All right, Ricardo, thank you so much.
Thank you. This was easy.
Thank you. All right.
Yeah.
Thanks.